So what is the ABCDE approach to looking at a problem on your skin? So if you've seen something on your skin, hello and welcome to another weekly newsletter from Dr. Sunny Dhesi. Hi. It's been a few weeks since we've done this. Holidays have sort of got in the way and being away from clinic. So I am back and hopefully you're tuned in for a short but brief and sweet newsletter because I know everyone's busy now. It's the holidays, the summer, and hopefully the weather is changing. So this week's newsletter is going to concentrate on skin and skin cancer, and we're going to go through the ABCDE approach to looking at maybe something that's on your skin that you're worried about, and I'm going to demonstrate a little bit about what we do in clinic with a dermatoscope. So really, what do we do in clinic when we're looking at lesions on the skin that we're worried about? So please, if you haven't already, subscribe to the YouTube channel. We could always use more subscribers, and please do leave comments or feedback and about anything else you'd like to learn about or listen about from this newsletter. So thanks for watching. So what is the ABCDE approach to looking at a problem on your skin? So if you've seen something on your skin that's perhaps a mole or you think is a mole, so firstly you want to look for asymmetry. So normally when we look at a mole, it's very circular, it's very symmetrical. However, if you've noticed that there's an asymmetry, so one side is bigger or it's no longer a circle, it's more of a weirder shape, then that's definitely one thing to watch out for. You need to look at the borders as well. So B stands for borders, and that's the borders of the mole itself. So for example, has it become irregular? Is it not as regular as it was before? Has it become sharp or jagged? Sometimes it's difficult to see that, but if something's got bigger on your skin, then generally the borders of that lesion can be disrupted. So that's another thing to watch out for. The next thing is to look for the color. So sometimes you might have noticed that it was much lighter in color, it's become darker. That's often the case for moles. Or if it was dark before and now it's become lighter, that is still a reason to seek medical advice. From C for color, so ABC, we've done color, we're now going to go on to diameter, and that's really about whether it's increased in size. So if you apply the diameter to any lesion or problem on your skin, if it's got bigger, the diameter's increased, then it's definitely something to seek advice about. And lastly, is it evolving? So evolving is like, is it changing in all the other things we've just discussed, like A, B, C, and D. Is it evolving? Is it changing? Is it becoming something that it wasn't before? So for example, in some skin cancers like BCCs or basal cell carcinomas, squamous cell carcinomas, they can indurate on the skin, they can form ulcers. So that's what we sort of apply to evolving. So this doesn't constitute medical advice. If you are worried, then seek advice from a healthcare professional like myself as a GP or a dermatologist. And if hopefully what you've learned today and what you're listening to will just help you to promptly to look at something on your skin and say, well, actually it has changed, I do need to seek advice. So that's the ABCDE approach to looking at lesions on your skin. What can we use in clinic to help us identify problems on your skin, especially when it comes to moles? So firstly, we have what we call a dermatoscope. So this is a kind of a self-enclosed magnifying device. We place this end on the skin. Sometimes we put a little bit of alcohol gel on to create a surface on there that can help and be enhanced in the light that shines through this. You can see here that as we shine this light, it's like a ring light. Place it on there, and then there's a magnification on there, which I'll show you. But by magnifying and looking at something under a dermatoscope, we can see the asymmetry of it, the symmetry of it. We can see the borders of it. We can see the color of it. We can see the diameter of it, and then we can see whether it's evolving or not. So we can apply that ABCD approach, which I spoke about earlier. So that's a dermatoscope. That's what we use in clinic. And then as part of our Map Your Mole service, which is more information is available on the website, we can attach this little lens device on the back of our phone, back of my phone, I should say. And what happens is that we can take pictures with this. This is where I spectacularly failed. In fact, I just made a mistake there. So what you need to actually do is take the case off your phone. So this lens was actually supplied by the Map My Mole service, and what we do is, boring as it is watching paint dry, is we can attach it on to the lens itself. we can then apply that onto a lesion, take a picture of it, describe the symptoms, describe what's happening with it, that ABCDE approach, and then send it off to a dermatologist, and then we get a report back. They also send the report to the patient, so the patient gets an immediate response. And then if there's anything concerning or urgent, they can obviously seek medical advice, go to their GP, get a referral, or we can make the referral in clinic ourselves. Not back to the NHS, but privately we can. You can utilise private medical insurance. And then if there's anything that it's not cancerous or it's not urgent, then we can sometimes treat that with liquid nitrogen, which I've demonstrated before. So if you are worried about any skin lesions, please do contact us. We have a mole mapping service. We can't do large areas. We can do up to 4 lesions in one go. Costs are on the website, fees are on the website. I hope that was useful, especially at this time of the year when t-shirts and things are coming off. You start to notice things a lot more. It's always good to check your partner's back because it's something that they can't see, and get someone else to check your back as well. Thank you for watching. That was this week's newsletter, more concentrating on skin and skin cancer. Remember, prevention is better than cure, so do apply sunscreen first thing if you are going out, especially if you're on holiday, and then remember to reapply it every 2 hours. And if you are worried about anything, as we've discussed, then please get in touch with us or get some advice from your own healthcare professional. Thanks very much for watching. I'm Dr. Dhesi, and this is Vysana Life.